Thanks for watching the video on Medicare Supplement policies, sponsored by Senior American Agency and MedicarePlanChoice.com. If you have questions during business hours, 8 a.m. to 3 p.m. Eastern Standard, call our toll-free hotline, 800-332-7557, or send an email to dan@senioramericanins.com. At this point, you should be familiar with the overview of Medicare and the two ways that you can receive your Medicare benefits. This video will focus on the choice of a Medicare supplement policy to enhance the original Medicare Part A and B benefits. These policies are also known as Medigap policies. We'll look at the specific benefits within them and the standard lettered plans. We'll also help you correlate those benefits to the gaps left over after original Medicare pays. At this point in time, you should have an understanding of the two ways that you can receive your Medicare benefits, and we're just going to highlight some of the differences between the two. On the left-hand column are the attributes of original Medicare. On the right-hand column, the attributes of a Part C Medicare Advantage plan. Under original Medicare, Medicare itself does the physical administration and pays the bills. Many people will opt to have a secondary policy, a Medicare Supplement or Medigap policy, to help fill in the gaps after original Medicare pays. And many people will also opt to have a separate Part D plan to carry drugs because original Medicare nor the supplemental policies carry drugs. One of the advantages of original Medicare is the fact that there's no networks and there's no restrictions. You can see any doctor and go to any hospital in the country as long as they accept Medicare as payment. And by combining a Medicare supplement policy with the benefits of original Medicare, you can have a very comprehensive coverage. As a matter of fact, at this point in time, the Plan F with original Medicare covers 100% of the medical expenses that are covered under Medicare. So you can have a policy that literally has 100% coverage between the two. With Medicare Advantage, on the right-hand column, Medicare Advantage plans, as we had stated in the past, are all administered by private insurance companies, and many will have those network or doctor restrictions that you can only go to certain doctors or certain hospitals within the plan service area. And many of them have co-payments that can obviously add up. Those plans are divided into individual categories, each category having a different co-insurance or co-payment that would be due upon taking the service. And many of those Medicare Advantage plans do include a Part D drug benefit. So again, those are just the attributes, some of the attributes of original Medicare and some of the attributes of a Medicare Advantage Part C plan. One of the statements that we just made is that when you combine original Medicare with a comprehensive Medicare supplement policy, you can have little or sometimes no out-of-pocket expenses for big items like hospital stays, skilled nursing stays, outpatient surgeries, medical equipment, ambulance costs, chemotherapy and radiation. These folks are kind of the big out-of-pocket expenses that people worry about. What if I had a heart attack and needed heart surgery? What if I got cancer and needed cancer therapy, chemotherapy, or radiation? We know that you can literally have a zero out-of-pocket expense when you combine original Medicare with a Medicare supplement policy. With a Medicare Advantage plan, there's a lot of question marks because each one is operated differently, and you again have to examine the evidence of coverage or the outline of benefits prior to enrolling into the Medicare Advantage plan so that you know up front what the out-of-pocket expenses are for the different services that you might receive. So the one thing that you know is that your big bills can be covered very comprehensively when you combine original Medicare with a Medicare supplement policy and with a Medicare Advantage plan. That might not be the case. There might be other out-of-pocket expenses. Some of the obvious reasons why we just discussed that people would have a Medicare supplement policy. Number one, you can get a very comprehensive healthcare policy when you combine original Medicare with a supplement. We talked about the fact that you can budget your healthcare expenses so that you know what your monthly and annual costs are going to be up front rather than determining paying service to service as you would with a Medicare Advantage program. Again, the freedom to visit any doctor, any hospital in the country is very important, so there's no networks, no referrals, no pre-authorization. And another important reason is the fact that Medicare supplement policies are guaranteed renewable. That means that they can never cancel you because of your age or because of your health conditions. They can't charge you any more premium than the next door neighbor. Everybody is going to pay the same rate with the same plan and company. So those are some of the reasons why people would choose Medicare supplement policies. Before we can look at what a Medicare supplement policy specifically can cover, we first have to understand what Medicare pays for, because that would be considered the primary insurance, and the supplemental policy would help to pick up some or all of the balances that were left over. On this chart we have the 2014 Medicare Part A benefits, and within that chart there's 3 columns. The first column would be the type of service that you might use. The middle column would be how much Medicare pays towards those services. The third column would be what you would be responsible for should you have just Medicare alone. On the far right, we have a column that says what a Medicare supplement policy can cover, and in that it gives 3 specific benefits that can be within your Medicare supplement policy, and those benefits are optional depending on the letter plan that you choose. We'll examine first the Part A deductible. The Part A deductible, if you have a confinement into a hospital, each confinement sparks a 60-day benefit period. During that benefit period, Medicare will pay for most costs after either you or your insurance pays the Part A deductible. The Part A deductible for this year would be $1,216, and if you have the Medicare Part A deductible benefit within your Medicare supplement policy, that will cover the corresponding $1,216 Part A deductible. The Part A deductible is important because not only is it expensive at over $1,200, but it can happen more than once a year because each benefit period with Medicare lasts only 60 days. So that means there could actually be 5 of those Part A deductibles charged during the year. The second item we'll look at, we'll just put a loose term of extended hospitalization because it will only occur if you're hospitalized longer than the initial 60-day benefit period. If you're hospitalized between days 61 to 90, Medicare will pay all eligible expenses after you or your insurance pays a per-day copayment of $304. $304 times the 30-day benefit period would be a potential out-of-pocket expense of $9,120. Between days 91 to 150 are considered lifetime reserve days, which means you can only use those once in your lifetime. If you do use those days, Medicare will pay for all eligible expenses after you or your insurance pays a $608 per day copayment. That could add up to $36,480. And if you're hospitalized longer than 151 days, Medicare itself pays nothing. However, the basic benefits of a Medicare supplement policy will pay the cost for an additional year beyond Medicare. Basic benefits are the minimum threshold of coverage that all Medicare supplement policies must have. So if you have any Medicare supplement policy, regardless of the plan letter, it will have the basic benefits within it, and that will cover those extended hospital days. The third item we will look at is the skilled nursing coinsurance, or the skilled nursing benefit. If you're confined in a skilled nursing facility for short-term rehabilitation, again, Medicare itself will cover the first 20 days at 100%. Medicare will continue to pay for another 80 days for a total of 100. During those 80 days, you or your insurance would be responsible for $152 per day. So that 80 days times 152 is a potential out-of-pocket expense of $12,160. And again, if you have the skilled nursing coinsurance benefit within your Medicare supplement policy, that will cover the corresponding costs. So the 3 important items under Part A Medicare is the Part A deductible, the extended hospital days, and the skilled nursing coinsurance. And with your Medicare supplement policy, when we get into examining the specific letters, most but not all will have the Part A deductible included in it. All of the policies will have the basic benefits, and most of the policies will also have the skilled nursing benefits. So those are the 3 items that you want to look at specifically in your policy to cover those corresponding costs that original Medicare does not. Next, we will look at Part B Medicare. Next, we will look at Part B Medicare. Medicare Part B is considered the medical expense category of Medicare and pretty much consists of any service that you receive on an outpatient basis, including outpatient hospital services like outpatient surgeries and so forth. So it can be any service that's provided on an outpatient basis. It can be medical equipment, wheelchairs, walkers, could be ambulance bills. There's a broad category of expenses that we're going to fall under Part B of Medicare. Medicare Part B generally consists of an 80-20 coverage. Most people are familiar with the fact that Medicare pays 80% of the medical expenses, and obviously that leaves a 20% balance for either you or your Medicare Supplement policy to cover. Many people obviously want coverage for the 20% because 20% of medical services today can add up to a lot of money. Before Medicare begins to pay their 80%, there is an annual deductible. In the year 2013, it was $147. So you need to pay the first $147 before Medicare begins to pay the 80%. And Medicare does pay 80%, but not necessarily 80% of the bill. Medicare pays 80% of the amount that's approved by Medicare. So they pay on a schedule that whatever the approved amount is, that's what they pay 80% of. And then either you or your insurance covers the other 20% of the balance. There are a couple other items under Part B of Medicare. Clinical lab services. Many of the clinical lab services are paid 100% by Medicare. That leaves no balance. And blood is considered a Part B expense. Medicare pays after the first 3 pints of blood, and either you or your insurance has to cover the first 3 pints of blood. So generally, Medicare Part B is any expense that's covered given on an outpatient basis. Medicare pays 80% of those expenses, and either you or your supplement has to cover the other 20% after $147 annual Part B deductible. And the 3 items that would be covered under the basic benefits, or I should say the 2 items under Part B, would be the 20% of the balance and the first 3 pints of blood. Because those are in the green color scheme, they equal the basic benefits. So if you have a Medicare Supplement policy, they have to cover the minimum of the basic benefits, which would be the 20% and the first 3 pints of blood under Part B Medicare. Medicare supplement policies are standardized in most states. What that means is it doesn't matter what insurance company you buy the policy from, you're getting a standard list of benefits in standard policies. The policies are designated by letter: Plan A, Plan B, Plan C, D, F, G, K, L, M, and N. So every company has the standard policies. So the only differential between companies would be the reputation of the company you're buying the product from, their financial strength and ratings and how long they've been in business, etc. The service that you might get from that particular company or that company's agent, and how much you pay for the policy, because although all the plans would be standardized, not all companies would charge the same amount for each plan. So let's take a look at the plans themselves. The way it works is what's listed underneath the letter is what's covered underneath the plan. As you can see, Plan A would be considered to be the least comprehensive because it has the least amount of coverage in it. Plan F is considered to be the most comprehensive, and Plan F is considered to be the most common Medicare supplement plan choice in the country. We do highly recommend that policy, although it's generally one of the higher premium plans as well. So let's take a look and dive into the benefits within these standard plans. As you can see, the 3 color scheme that we had, with the basic benefits being horizontally across the first line, the Part A deductible horizontally on the second box, and the skilled nursing coinsurance horizontally in the third box. Those are the 3 core benefits that we feel are important, and those are the ones that our clients typically ask to be covered for because they are typically the highest out-of-pocket expenses. As you can see, Plan A does not cover the Part A deductible or the skilled nursing, and Plan B does not cover the skilled nursing. So we usually discount those policies and do not usually recommend them because they don't give the core benefits that most of our clients are asking for. The plans K, L, and M have asterisks under several of the boxes, and that means they pay differently from some of the other policies. Essentially, plans K, L, and M are more of a high deductible plan. As an example, under the Part A deductible for the 2013 year would be $1,184. Plan K only pays 50% of that benefit. So you would pay the other half out of pocket, so that would be another almost $600 out of your pocket. And the skilled nursing coinsurance, it only pays 50% because that total added up to over $11,000. That could be another $5,500 out of your pocket. So high deductible. Plan L would cover 75% of those items and leave you a 25% copayment. M again is 50% on the Part A deductible and all of the skilled nursing. So because those policies are high deductible, we typically do not recommend those. They do have an out-of-pocket limits of $4,200 or $2,300. What that means is if you spent that much in out-of-pocket expenses after you paid the premium, from that point forward the policy would pay for the rest of that calendar year 100% on the benefits. So we do not usually recommend the high deductible plans or plans A and B. So the plans that we typically recommend that give you the core benefits that we discussed are C, D, F, G, and N. Of those policies, typically we recommend Plan F and Plan N. Those are the two policies that we feel give the core benefits. They cover the basic benefits. Obviously, that covers the 20%. The Part A deductible, which would be the first day in the hospital fully, and the skilled nursing fully, so you have no out-of-pocket expenses there. The difference between those two plans would be the Part B deductible, which for the 2013 benefit year would be $147. Well, that's obviously not a part that's going to wipe you out, $147 a year, and they both have foreign travel within them. Excess charges are addressed in plans F and G. Essentially, what that means is if by law they're able to charge more than the Medicare approved amount, we discussed that Medicare pays based upon their approved amount. If the providers are able legally to charge more than that, they would cover the excess charges, the amount above the Medicare approved amount. Many states, however, do have laws in force to protect the consumer and not have them the providers themselves able to charge a maximum of percentage, or so that may not be a benefit that has value. You would have to look at your state laws to see how important that would be in your particular area. But Plan F is typically a high benefit plan with one of the higher premiums. We like Plan N because it gives you the core benefits. It gives you that first day in the hospital. It gives you the 20% and the skilled nursing. So those are the big bills. It leaves $147 once a year, which is no big deal. And it has an asterisk under the basic benefits. The reason why that's there is because Plan N, you do pay a $20 copay if you go to either a plain Jane doctor visit, whether it be a specialist or a primary care physician. You pay a $20 copayment. And if you're admitted to, if you're go to the emergency room and are not admitted, I should say, to the hospital, then you do pay a $50 copay for the emergency room. But if you're admitted, then it goes back to the Part A deductible and it's fully covered under that benefit. So the two policies, as we discussed, that we typically recommend are Plan F and Plan N. We would highly recommend those policies. I'd love to give you a quote right here and now on those two policies, but because the premiums differ by state to state, county to county, zip code to zip code, we can't give you a quote on this broad category. We will give you a quote if you call us on the phone or give us a email, a quote at 65medicareinfo.com. We will certainly get back to you with a quote for your specific area, and we will go into a little bit more detail next. But for right now, the standard policies that we typically highly recommend are Plan F and Plan N. We just talked about Medicare Supplement Plans N and Medicare Supplement Plans F, And what we're going to do on this page is we're going to take a look at a hypothetical service. A person that had stay in the hospital. They had to go into skilled nursing for 23 days to recuperate. They had to meet the Part B deductible, and they had to go to a couple of doctor visits. And what we're going to look at is if a person had just original Medicare A and B and paid the rest out of pocket on their own, what would their out-of-pocket expenses be for these services? And then we're going to examine the person that has Medicare Supplement Policy Plan N and what their out-of-pocket expenses would be for those same services, as well as Plan F. So the first thing we'll look at is the Part A deductible for the hospital stay. The person that had original Medicare loan would have to meet that out of pocket, so that would be a $1,216 out of pocket expense for that person. The person that had Medicare Supplement Plan N would pay nothing, as well as Plan F. They would pay nothing because those both have the Part A deductible built into the Medicare Supplement policies. The skilled nursing facility, if you had a 23-day stay, again, remember that Medicare covers days 1 to 20, but after that it's $152 a day. So for those 3 days, the person with straight Medicare had to shell out $456 for those 3 days, while the person with Medicare Supplement Plan N and Plan F paid nothing because their insurance covered what was left over. The Part B deductible for this year is $147. So again, the person with original Medicare had to cover that out of pocket, as well as the person with Medicare Supplement Plan N, because that does not cover the Part B deductible. Plan F, however, does cover the Part B deductible, so that person would not pay anything for that particular service. Part B coinsurance for 2 visits. Again, original Medicare after the deductible pays 80%. We're just going to call the 20% for those 2 doctors $40. And we're going to call the Plan N Medicare Supplement policy. Remember, we discussed that that would have a $20 copayment for those doctor visits as well. So that person also paid $40 for the 2 doctor visits. The person with Medicare Supplement Plan F paid nothing because that covers everything that Medicare does not. So the total for a hospital stay, 23 days in skilled nursing, and 2 doctor visits for the person with original Medicare, that person put out $1,819 for that particular scenario. The person with Medicare Supplement Plan N, as you can see, paid significantly less at $187, a small amount in comparison, about 10%. The person with Plan F paid nothing because that Medicare Supplement Plan F picked up everything that Medicare left behind. So this is a comparison again between a particular services, a person with original Medicare and a person with plans, Medicare Supplement Plans N and F, and what they paid out of pocket for those services. Here's a few items to remember for a new person on Medicare starting right off with a Medicare Supplement policy. First of all, people entering Medicare for the first time are considered guaranteed issue, and this means that companies won't ask any medical questions, and all health conditions are covered even if they're pre-existing. So that means there's no pre-existing condition limitations. Policies are also considered guaranteed renewable for life, so regardless of your age or health or number of claims used during the policy, you can never be canceled. The policy is guaranteed to be renewable for your lifetime. Companies are also giving discounts and competitive pricing for those new Medicare members who start right off with a Medicare Supplement policy. And there's no rate up for smokers, so even if you smoke during the guaranteed issue time period, you get the preferred rates. So those are just a few things to remember for a person starting off on Medicare and going right into a Medicare Supplement policy. If you are watching this video via a DVD disc, you might already have a quote included in your package. To take advantage of that quote, simply return the application with payment for the first month. To get a quote from the MedicarePlanChoice.com website, go to Get a Quote or Web Chat and follow the instructions. If you need assistance or need to discuss your situation, our telephone support line is open every business day from 8 a.m. to 3 p.m. Eastern Standard at 800-332-7557. To get a quote via email, send a request to dan@senioramericanins.com. Include your state, county, and zip code. If you're not just starting out on Medicare, include your age, gender, and smoking status. Thank you for trusting us to be your resource on Medicare information and products. We promise to give you our best effort with any needs you might have as a client. And again, thank you for allowing us to fulfill our goal to be the #1 service agency for new Medicare enrollees. Thanks again.